Hello friends, welcomes you all. Myself Dr. Deepak, and today we are going to discuss about the anatomy of nose. So the nose, it is a most prominent structure of the face. Its main function is olfaction and it also provides a passage for the respiration. So the olfactory organs are present into its upper one-third part of nasal cavity. The upper one-third part of nasal cavity, it is lined by the olfactory mucosa, whereas its lower two-third part, it is lined by the respiratory mucosa. This respiratory mucosa, it is rich in the blood supply, so the inspired air is warm in this area. The serous gland present into this nasal cavity are provide serum for the moistening this air, and the mucous gland present in this nasal cavity are trap the dust particle of the inspired air. So here the inspired air becomes warm, then moist, and become dust free, means clear. So the air conditioning function is done in this nasal cavity. So this nose can be divided in the two parts, the external nose and the nasal cavity, for the descriptive purpose. Let me first discuss about the external nose. So the external nose, it is formed partly by the bones and partly by the cartilage. So main bones which are participating in the formation of the nose, they are the nasal bone and the frontal process of the maxilla bone, whereas the cartilage participating in formation of the nose, they are the upper two lateral cartilage, then lower two alar cartilage, and some small minor alar cartilage, about 3 to 4 minor alar cartilage are also participating in the formation of this external nose. Its lower part is formed by the fibrofatty tissue. Okay, this external nose, it is supplied by the infratrochlear infraorbital nerves. Then the nasal cavity. So the nasal cavity is divided in the right and left two parts by the median nasal septum. Okay, so this each cavity has a roof, then floor, then medial wall and the lateral wall. So its roof of this cavity is mainly formed by the ethmoid bone in the central area, on the anterior part by the nasopalatine part, and on the posterior part by the sphenoid bone. Okay, so these all structures are forming the roof of the nasal cavity. Then its floor, it is mainly formed by the anterior side by the maxilla bone, then the posterior side by the palatine bone. Okay, so it is about the roof and the floor. Then it is a two walls, the medial wall and the lateral wall. So its medial wall, it is also known as a nasal septum. So this medial wall, it is formed by the bone and the cartilage. So main bone participating in formation of this medial wall, they are the vomer bone and the perpendicular plate of the ethmoid bone. On the anterior side, it is formed by the cartilage. The main cartilage participating are septal cartilage and the alar cartilage are participating in the formation of the nasal septum. The bones, some bones are also participate in the formation of this nasal septum. They are the nasal bone, then the frontal bone, then the palatine bone and all these. Okay, so this structure, it is a nasal septum. Then its lateral wall. So its lateral wall, it is also formed partly by the bones and partly by the cartilage. So from anterior to posterior side, if we see, so the nasal bone here, then this, it is a frontal process of the maxilla bone, then here it is a lacrimal bone, Then here it is the ethmoid bone, the superior concha and middle concha are the parts of this ethmoid bone. Then the inferior nasal concha, then this it is a wormer bone, and then the sphenoid and the pterygoid plate. These bones are participating in the formation of the lateral wall. Then the cartilage are the two lateral processes of the septal cartilage are participating, and major and minor alar cartilage are also participating in the formation of this lateral wall. This lateral wall has a three part. Its anterior most part it is known as the vestibule. Then on the posterior superior side it is known as a atrium, and then there are the nasal concha and the meatus are present in this lateral wall. Okay, so the other all theory of this nasal cavity and the external nose, we will discuss this theory into a chart form. So let me start. Now we will discuss the anatomy of nose by this chart. So let me see. The nose is divided in the two main parts, the external nose and the nasal cavity. Okay, so the external nose, it is a outer bony structure and it is formed by partly by bone and partly by the cartilaginous structure. So which bone are participating for formation of external nose? So mainly the nasal bone and the frontal process of the maxilla. Then which are the cartilage participating in formation of external nose? So they are two lateral cartilage, two alar cartilage and one septal cartilage. These lateral cartilage are also known as a superior nasal cartilage. The alar cartilage are also known as the inferior nasal cartilage, and one septal cartilage. And there are also some pieces of cartilage, about 3 to 4 pieces of cartilage. Okay, so these all are participating in formation of the external nose. Then the parts of the external nose. So they are the root, then dorsum, then tip, then anterior nares, nasal septum and the columella. Okay, so this is a root, then this bridge it is a dorsum, then the tip, then these openings are the external nares or anterior nares, then the median septum, it is a nasal septum, and the anterior most part where the hairs are present, it is known as a columella. Then the nasal cavity. Okay, so the nasal septum, it is divide the cavity of the nose into the right and left cavity. So this each cavity has a roof, then floor, then medial surface or nasal septum and the lateral wall or the lateral surface. Okay, so the roof of the nasal cavity is parts. So it has a frontonasal part, its anterior part, it is a frontonasal part. Then the ethmoid bone is present, so ethmoidal part. Then the sphenoid bone is present, so the sphenoidal part. So it has a three parts. The anterior most, it is a frontonasal, then ethmoidal and then the sphenoidal. The length of the roof, it is 7 centimeter, and the width of this roof, it is 2 millimeter. Okay, then the floor. So the floor, it is formed by the palatine process of maxilla bone on the anterior side and the palatine bone on the posterior side, and it is about 5 centimeter long and its width is about 1.5 centimeter. Then the medial wall of the nasal cavity or the nasal septum. So it has a 4 borders: superior border, inferior border, anterior border and posterior border, and 2 surfaces are present, the right and the left surface. And the parts of the nasal septum, so it has a 3 parts. It is a bony part formed by the bone, then cartilaginous part, and the anterior most cuticular part, means the part which is formed by the soft tissue and lined by the skin. This is a cuticular part. So the bony part of the nasal septum. So which bone are participating in formation of this bony area? So mainly it is formed by the vomer bone and the perpendicular plate of ethmoid bone. These two bones are mainly participating in formation of the bony nasal septum. So they are the vomer and the perpendicular plate of the ethmoid. But the bones present around, they are also participating in the formation of these bony structures. So they are the nasal spine of the nasal bone, then the frontal bone, the frontal spine of the frontal bone, then the dorsum of the sphenoid bone, then palatine bone and the maxilla bone. These all bones are also participating in formation of the nasal septum, the bony part of nasal septum. Then the cartilaginous part. So the cartilage, which cartilage are participate for formation? They are the septal cartilage, mainly the septal cartilage and the septal process of LR cartilage are participate. Main two cartilages, they are the septal cartilage and the septal process of the LR cartilage. Then the cuticular part. The cuticular part, it is the anterior most part of the nasal septum and it is formed by the fibro-fatty tissue and it is lined by the skin and it is known as a columella. Okay, this anterior most part of the nose, it is known as a columella. Then the lateral wall of the nasal cavity. So it is also formed by the bone and the cartilage, partly bony and the partly cartilaginous. Now the lateral surface of the nasal cavity. So this lateral surface, it is also partly bony and partly cartilaginous structure. The bones participating in formation of the lateral wall, they are the from forward to backward, they are the nasal bone, then the frontal process of the maxilla bone, then the lacrimal bone, ethmoid bone, then inferior nasal concha, it is an individual bone, then the palatine bone and the medial pterygoid plate. Okay, which bones are participate from forward to backward? They are the nasal bone, frontal process of the maxilla bone, lacrimal bone, ethmoid bone, inferior nasal concha, palatine bone and the medial pterygoid plate. These all bones are participate in the formation of the lateral wall. Then the cartilage, all the cartilage, they are superior nasal cartilage, inferior nasal cartilage and 3 to 4 small cartilage. These all cartilage are participate in formation of lateral wall. They are the superior nasal cartilage, then the inferior nasal cartilage and the 3 to 4 small cartilage. Okay. Then the parts of the lateral wall is the nasal septum has a 3 part, the bony, cartilaginous and cuticular part. As like the lateral wall, it has a 3 parts. On anterior most side there is a vestibule, then the atrium, and on the posterior side there are the concha and the meatus. Okay, so its anterior most part, the vestibule, it is a small depressed area on the anterior side. It is lined by the skin and it has a short, stiff and curved hairs. The hairs are present on this area. This area, it is a vestibule. Okay, then the atrium. So atrium, it is a shallow depression in front of the middle meatus and above the vestibule. Above the vestibule and in front of the middle meatus, there is the presence of the atrium. It is a shallow depression. Then the concas. The concas are present on the lateral surface and they are the shelf-like bony projection. Okay, these concas, they are the 3 concas. These concha are the shelf-like bony projection. What is the function of this concha? Why they are present in this cavity? So because they increase the surface area for air conditioning of the inspired air. Okay. Then concas and meatus. So first of all, the superior concha, it is the smallest concha and it is a projection of the ethmoid bone. Means it is a part of the ethmoid bone. It is arise from the ethmoid bone. It is the smallest concha and it is projected from ethmoid bone. Then the superior meatus. Okay, so in this superior meatus there is a opening of posterior ethmoidal sinus. The posterior ethmoidal sinus, it is open into this superior meatus, and on the superior side, on the supero-posterior side, means superior and posterior side of this superior meatus, there is a sphenoethmoidal recess are present, and in this sphenoethmoidal recess there is a opening of sphenoidal air sinus. Okay, the sphenoethmoidal recess, it is a depression on the supero-posterior side of this superior meatus, and here the sphenoidal air sinus is open into this sphenoethmoidal recess. Then the middle concha. So the middle concha, it is also a projection of the ethmoid bone. Okay. Then the middle meatus is present inferior to the middle concha, means in between the middle and the inferior concha. So this middle meatus, in this middle meatus there are two main structures are present, and they are the ethmoidal bulla and the hiatus semilunaris. Okay, so the ethmoidal bulla means if it is a middle meatus, it is a area of middle meatus. So here is a rounded prominence, and this rounded prominence, it is known as a ethmoidal bulla, and on the anterior side of this ethmoidal bulla there are one semilunar sulcus is present here, and this semilunar sulcus, it is known as a hiatus semilunaris. Okay, why these structures are present into this middle meatus? Because in the middle meatus the four sinuses are opens. Okay, so this ethmoidal bulla, it is due to the projection of the ethmoid bone. Okay, because on this ethmoidal bulla there is an opening of middle ethmoidal sinus, so it is a projection due to this middle ethmoidal sinus. So here on the central part of the bulla there is a one opening, and this opening is for the middle ethmoidal sinus. Then the hiatus semilunaris, so on the anterior part of this hiatus semilunaris there is a opening of frontal air sinus. The frontal air sinus, it is opens into its anterior part. Then on its middle part there is a opening of anterior ethmoidal sinus. The anterior ethmoidal sinus, it is open into its middle part, and its posterior end there is a opening of the maxillary sinus. So the maxillary sinus is open at here on the posterior end of this hiatus semilunaris. Okay, so the hiatus semilunaris, it is a sulcus present anterior to the ethmoidal bulla, and the ethmoidal bulla, what is the ethmoidal bulla? It is a bony projection because of the middle ethmoidal sinus. Okay, so here the name of the sinus and opening of the sinus is, so the frontal air sinus, it is opens into the anterior end of hiatus semilunaris. Then the anterior ethmoidal sinus present at the middle part of the hiatus semilunaris. Then the maxillary sinus, it is opens on the posterior end of the hiatus semilunaris, and the middle ethmoidal sinus, it is opens at the ethmoidal bulla. Okay, then the inferior concha. So the inferior concha, it is a independent bone. It is a one separate bone. It is not part of any one bone. As we have seen, the superior concha and middle concha, they are the part of the ethmoid bone, but here the inferior concha, it is not part of the ethmoid bone or any other bone, but it is an individual bone. Okay, so it is a one independent bone. Then the inferior meatus, it is lies inferior to the inferior concha, okay, and it is the largest meatus, okay, it is the largest meatus. Oh, and here there is an opening of nasolacrimal duct, the duct which is connect the lacrimal area to the nasal cavity, it is a nasolacrimal duct, and this nasolacrimal duct, it is open into this largest meatus, the inferior meatus. The duct is guarded by a valve, and this valve, it is known as a Hasner's valve, okay. The duct is guarded by the valve, and these valves are known as a Hasner's valve, okay. So hope so you may understand this all structure, okay. Let me quick review the external nose. The main two part of the nose, they are the external nose and the nasal cavity. The external nose, it is partly bony, partly cartilaginous. The bones participating, nasal bone and frontal process of maxilla, and the cartilage, two lateral cartilage, two alar cartilage, and one septal cartilage. Parts of the external nose: root, dorsum, tip, anterior nares, nasal septum, and columella. Then the nasal cavity, it has a roof, floor, nasal septum, and lateral wall. The roof has a parts, the frontonasal part, ethmoidal and sphenoidal part, length about 7 cm and width about 2 mm. Floor, it is formed by palatine process of maxilla and palatine bone. Length is about 5 cm and width is about 1.2 cm. Nasal septum, it is a 4 border, superior, inferior, anterior, posterior. 2 surfaces, right and left surface. 3 parts, bony, cartilaginous, and cuticular. Bony part is formed by mainly vomer and perpendicular plate of ethmoid, and partly by the nasal spine, frontal bone, rostrum of sphenoid, palatine bone, and a maxillary bone. Cartilage are the septal cartilage and septal process of the alar cartilage. Cuticular part, it is a fibrofatty, formed by fibrofatty tissue, and it is known as a columella, okay. Then the lateral wall, it is partly bony, partly cartilaginous. Bones are nasal bone, frontal process of maxilla, lacrimal, ethmoid, inferior nasal concha, palatine process, and medial pterygoid plate. Cartilage are the superior nasal cartilage, inferior nasal cartilage, and 3 to 4 small cartilage. Parts of this lateral wall, they are the vestibule, atrium, and concha, and meatus. So vestibule, it is the anterior-most part, small depressed area lined by modified skin and having short, stiff, curved hairs. Then atrium, it is a shallow depression in front of the middle meatus and above the vestibule. Then concha, they are the self-like bony projection. And what is the function? Increase surface area for the air conditioning of the inspired air. How many conchas and meatus? 3 meatus and 3 conchas are present. Superior concha, it is the smallest concha, projection of ethmoid bone. Middle concha, it is the projection of the ethmoid bone, and inferior concha, it is an independent bone. Meatus, the superior meatus opening, there is the opening of posterior ethmoidal sinus. On posterior superior side of this superior meatus, there is a shallow depression, the sphenoethmoidal recess, and there is the opening of sphenoidal air sinus. In the middle meatus, there are 4 sinuses are opens in the frontal, and frontal air sinus is opens into the anterior end of hiatus semilunaris. Then the anterior ethmoidal sinus is open into the middle part of the hiatus semilunaris, and the maxillary sinus is opens onto the posterior end of this hiatus semilunaris. And here the middle ethmoidal sinus is open into this bulla at the ethmoidal bulla. Then the inferior meatus is largest meatus and opening of nasolacrimal duct and guarded by the Hasner's valve. Okay, so this is all about the nose. Now we will discuss about its arteries, nerves, and lymphatics. Okay, so let me see. Now let me discuss about the vessels and nerves of the nose. So here in this diagram you can see the artery supply of the nasal cavity. It is about nasal septum and the lateral wall. So it is the anterior part of the nasal septum and it is the posterior part of nasal septum. On its antero-superior part, the anterior and posterior ethmoidal arteries are supplying. On its antero-inferior part, the labial branch of facial artery it is supplying. On its posterior-superior part, the sphenopalatine artery it is supplying, and on its posterior-inferior part, the greater palatine artery is supplying to the nasal septum. Then the lateral wall. So on its anterior-superior part, the same arteries, the anterior and posterior ethmoidal arteries. Then on his antero-inferior part, the branch from the facial artery. Here is a labial branch of facial artery. Here it is a unnamed branch from the facial artery. It is supplying. On his posterior side, it is a branch from the sphenopalatine artery. Here in the nasal septum, the sphenopalatine artery, the main artery, it is supplying, and here on the lateral wall, the branch of the same artery, the sphenopalatine artery, it is supplying. On his inferior, posterior inferior part, the branch from the greater palatine artery. Okay, in the nasal septum, the main trunk of the greater palatine artery, it is supplying here on the nasal septum, and the branch of this artery, it is supplying to this lateral wall branch from the greater palatine artery. Okay, so on the anterosuperior side, the same arteries, the anterior, posterior, ethmoidal artery are supplying on both sides, nasal septum and the lateral wall. Antero-inferior side, here is a labial branch of facial artery. Here it is an unnamed branch of the facial artery. On his posterior-superior side, here is a on the nasal septum sphenopalatine artery. In the lateral wall, branch from the sphenopalatine artery. Okay, and his posterior-inferior side, greater palatine artery, and here on the lateral wall, branch from the greater palatine artery, it is supplying. Okay, hope so you may understand. Then the nerves. So on the antero-superior side of the nasal septum, okay, here it is a nasal septum. So on the antero-superior side, the anterior ethmoidal artery, it is innervated. On the antero-inferior side, anterior superior alveolar nerve. Okay, the alveolar nerve, it is a branch of the maxillary nerve. So these antero-superior alveolar nerve, it is supplying to this antero-inferior part of nasal septum. Then on his posterior-superior side, medial posterior superior branch of pterygopalatine ganglia. It is a branch of pterygopalatine ganglia. Okay, on this posterior aspect, on both the nasal septum and the lateral wall, on both these surfaces is posterior, and it is supplying by the some of the branch of the pterygopalatine ganglia. It is a common. Okay, on the posterior part, pterygopalatine ganglia, the branch from pterygopalatine ganglia, it is innervated. So here the branch, name of the branch on the posterior superior side of nasal septum, it is a medial posterior superior branch of pterygopalatine ganglia, and posterior inferior side, nasopalatine branch of pterygopalatine ganglia. Then on his lateral wall, on his anterior part, anterior superior part, anterior ethmoidal artery, the same artery. On his antero-inferior part, the anterior superior alveolar nerve, the same nerve, anterior superior alveolar nerve. Okay, then on his posterior superior side, lateral posterior superior branch of pterygopalatine ganglia. Here is a medial posterior superior, here is a lateral posterior superior. Because the nasal septum, it is a medial wall, so here is a medial posterior superior, and it is a lateral wall, so a lateral posterior superior branch of pterygopalatine ganglia. Okay, then on his posterior inferior side, nasopalatine branch here, and here the anterior palatine branch of pterygopalatine ganglia. The name of branch is anterior palatine branch of pterygopalatine ganglia. Okay, so you can commonly write that on the posterior side, on both these surfaces, the branch of pterygopalatine ganglia, it is innervated. Okay, the name of the branch on the nasal septum, it is a medial posterior superior. On the lateral wall, lateral posterior superior. In the nasal septum, it is the nasopalatine branch, and here on the lateral wall, there is a anterior palatine branch of pterygopalatine ganglia. Okay, now the veins. So the nasal septum, it is divided in the two parts, the anterior part and the posterior part. Its anterior part, it is drained by the facial vein. Okay, and its posterior part, it is drains into the pterygoid venous plexus. Okay, the pterygoid plexus of vein, it is draining to its posterior part, whereas the lateral wall, the three veins or venous plexuses are draining this lateral wall. Its anterior part is drained by the facial, middle part it is drained by the same the pterygoid venous plexus, in the posterior part it is drained by the pharyngeal plexus of the vein. Okay, so here is all about the arteries, nerves and veins of the nasal septum. Now the clinical anatomy. clinical anatomy of the nose. So here you can see that in the nasal septum, in its anterior part, antero-inferior part, here on his antero-inferior part, the anterior ethmoidal artery, it is reaching up to that. Then the labial branch of facial artery is also present here. Then the greater palatine artery, the branch of greater palatine artery are also present here, and the sphenopalatine artery is also reaching up to that. So all the arteries of the nasal septum are form one plexus here on its antero-inferior part, and this plexus, it is known as a Kieselbach plexus. What? It is known as a Kieselbach plexus, and this area it is known as a Little's area. What? This area it is known as a Little's area. It is a commonest site for the bleeding from the nose. The bleeding from the nose, it is known as a epistaxis, and it is the common cause for the epistaxis. This area it is known as a Little's area. Okay. Now the commonest infection in the nose, they are the common cold. The nasal septum on mostly it is not straight in all the persons. Okay, it is not straight in all the persons, but on its middle part it is always deviated on the left side or the right side. Okay, so this is all about its clinical anatomy of the nose. So hope so you may understand. So here the nose, anatomy of nose is completed. Thank you very much.